Good morning and welcome to the final session for today's Diversify event. I'm excited to serve as moderator for today's panel discussion, Diversity and Inclusion in a Time of Crisis. We have 4 local panelists that have been on the front lines to combat the 2 pandemics that have hit our community. Ray Bond serves as Chief Executive Officer of the Chattanooga-Hamilton County Medical Society, the Medical Foundation of Chattanooga, and Project Access. She chairs the COVID-19 Joint Task Force created by Mayor Jim Coppinger and Mayor Andy Burke. Ron Harris is Vice President of Diversity and Inclusion for Blue Cross Blue Shield of Tennessee. He is responsible for cultivating a corporate culture where diversity and inclusion are aligned with the company's corporate strategy and values. In 2019, Forbes ranked Blue Cross Blue Shield of Tennessee the #3 best employer for diversity nationwide. Shannon Stevenson serves as CEO of Simpa Community Care. She serves on many healthcare and government committees, including the Mayor's Joint COVID-19 Task Force. She also serves as president of the Ryan White Clinics for 340B Access. And last but not least, LaQuisha Ewing is a professional business and educational consultant with more than 18 years of experience. She holds multiple degrees in applied science, psychology, education, organizational leadership, Africana studies, and sociology. She is a founding member of the Sankofa Fund for Civic Engagement, an African American giving circle focused on projects for African Americans in the Chattanooga area. So if you guys that are logged in today are not ready, we have a powerhouse panelist for you guys today. Thank you all for participating and lending your expertise on 2 areas that are impacting our country today, COVID-19 and racism. I'm looking forward to a healthy discussion with this panel and know that each of you have so much to contribute to the conversation. Dr. Linda Wiley kicked off today's summit with a presentation on trust. The question that she posed to the group certainly aligns with our panel discussion. What role does trust play in circumstances surrounding people of color dying from COVID-19 at a higher rate than whites? And for those of you that were not part of the conversation this morning, what she shared is that people of color are oftentimes hired in lower level positions and experience a pay gap that limits where they're able to live, which impacts the quality of food they have access to in their neighborhoods, and of course leads to poor health. Oh my goodness, there were so many points on Dr. Pastor's keynote that stood out to me. One was his statistics on the number of Black and Latino families living below the poverty line in Chattanooga. I already knew it, but to see it on the screen, it absolutely blew me away. And it certainly aligned with Dr. Wiley's point about the pay gap for people of color. For me personally, the point that stood out the most was when he talked about Black sounding names versus white sounding names. My daughter, her name is Marquise, which is absolutely a Black sounding name. I was very intentional of giving her the middle name of Andrea, which on paper, most people would read as Andrea. So if we found that she was having difficulty finding employment due to her first name, she could very easily do an M period Andrea, and people would automatically assume something other than what her first name would imply. My son, on the other hand, I named him Justin, and I was very intentional with that name because as a Black man in America, I already knew all of the obstacles he would face simply based on his skin color. And as a parent, I did not want to put up a barrier just with names alone. So I want to reach out to our panelists. What were some of the takeaways from Dr. Pastor's keynote that stood out to you most? Ron Harris, I'll start with you. Are we out there? Ron, can you hear me?
I'm good. Can you hear me?
Okay, I can now, yes.
Okay. Again, first of all, it's great to see each one of you. Let me start off by thanking the Chamber for this event. It's important and it's incredibly timely. And let me recognize my very good friends, Dr. Linda Wiley and Jessica Stallings. I'm going to have to get used that she got married. And I'm going to say this because it's Juneteenth and I got to say something Black. So I'm going to say she jumped the broom and now she's Jessica Stallings Holder, my good friend. And so let me thank each one of you. I felt like when I listened to Dr. Pastor, I wish I had gone before him because several other things that I'm going to say, he's already said. But I thought the charts, the analytics, the informatics that he provided, to your point, Dionne, I thought was so very vivid. And I think he also stabbed us in the heart in a good way as he talked about the impact and really what Chattanooga looks like and those things that we need to do to be a better city, that we have some homegrown people here, people of color, who need to have an opportunity, and we've got to send the elevator back down to them as well. Everybody in Chattanooga, we're very capable people, but we feel like sometimes we always have to go out of town and bring someone in as if though we don't have qualified people here. I thank God I'm a native Chattanoogan, grew up in the projects, and I wear that as a badge of honor, particularly serving in the role that I serve. And I often remind people growing up in the project gives me an added advantage because I know that the roaches scatter when you turn the lights on. I know that the rats come out when you have company. And so I spend a lot of time trying to use that background as a motivator and to inspire other people of color in our community. But I think he had some very salient information that the chamber and that each one of us who participated should draw from and use as a springboard to make our city a better city. He said a number of things about the demographics of our city, the standard metropolitan statistical area. He talked about, and my takeaway from that was people who might not be qualified does not mean they're not qualifiable. And so we need to spend more time reaching in instead of reaching out. There's got to be a greater mixture. We have some very smart people here in Chattanooga. We have some very energetic young people here in Chattanooga. So I thought he was right on point, and I thought his presentation just graphically showed the work that we need to do.
Absolutely. Ron, I am not a native of Chattanooga, but that is a point that I've heard very often in my career, how employers are reaching out outside of the area to find talent. And there is so much great talent here in Chattanooga. So I hope those employers today are listening and taking note. LaQuisha, I wanted to switch over to you. He talked about the high number of kids of color concentrated in high poverty schools. And I know that that is your background. And I know when the schools were closed in Hamilton County, We Over Me played an integral role of making sure that they reached out to those students in those schools. Will you talk a little bit about what you heard from Dr. Pastor's presentation and what that meant to you and the work that you do?
Sure. So good afternoon, or good morning, I guess, still to everyone. I think it's very important. I think Mr. Harris hit the nail on the head talking about focusing locally and being able to look at ourselves. I apologize if the preacher in me comes out, but really taking the time and looking in the mirror and looking at ourselves. Our children are a reflection. Our schools are a reflection. You know, I often say that schools are a microcosm of the greater community. So the disparities that we saw when it came to the COVID crisis, and then the tornado, and then, you know, now what we're looking at with this kind of compounding racial tension being brought to the forefront. I'm not going to say that the racial tension or the racial reconciliation topic or racial injustice topic is new, but being brought to the forefront. I think we could take a sample out of any of our school policies, procedures, and operational guidelines and see that it's a reflection of how our community lives and exists. It should not be that your zip code dictates the quality of education, the number of resources that you have. We should have an opportunity for all of our children, regardless of their learning style, to be able to access what they need. One of the things that I like to say when we talk about racial injustice or racial inequity is that if you can look across the span of school systems or school buildings, if you can look across that landscape here in Hamilton County and pull out a random sample of 12 kids, those 12 kids should be able to be placed in a situation where they thrive, whatever their learning ability is, whatever their learning level is, they should be able to thrive and then become productive additions and productive citizens into our community. So for him to throw up all of the data today was great for me because there is an economic case for the genocide that I call it genocide that I see happening with children of color in our public school system, specifically in our public school system. Understanding that, for several years, our county didn't even fund public schools adequately. And so what happens is you're faced with a changing society that is using an old time method. When you think about when public schools were created post-Reconstruction, it was to give us 3 tiers of labor force. Our laborers, our mid-level managers, and then our top tier. And that's what the school system was created post-Reconstruction to do. That structure does not work in 2020. We have to open up our mind and open up our thinking around policy and procedure and how we educate our kids, because right now we have potential that's dying in our public schools. People that may have the freaking cure to corona, but they don't have a science lab. That may have, they may have the mathematical genius to fix our economic debt situation, but they don't have the AP courses that could get them there. So I'll stop right there before I finish the whole panel.
LaQuisha, I could talk with you all day or listen to you talk about that all day long. And I just want to say, I love your background, my sister. I love it.
The preacher in her did come out.
Absolutely. Absolutely. I know between the two of you, we will certainly have some church today. Okay. So everybody get prepared. Ray, I wanted to shift gears a little bit and talk about the COVID-19 Joint Task Force. Tell us some of the measures that the task force has taken to combat COVID-19 in Hamilton County. And welcome to the panel.
Thank you. It's a pleasure. And I want to say the thing that I found most encouraging about Dr. Pastor's presentation is the generational differences in attitudes about diversity and attitudes about race. I think that is a hopeful and very encouraging sign, and I hope that we are wise enough to let the generations coming after us to help lead the way as we build a better community. The COVID task force has kind of metamorphosized a little bit. It was initially started to provide some health and medical advice to the city and the county mayors, but as we started talking about the pandemic, we recognized that we could play a very significant role in coalition building and community building, looking at the unique ways that COVID was impacting our community specifically. And so we've really used the task force. So while we do advise Mayor Burke and Mayor Coppinger on all things related to COVID, we've also used it as a platform to try to stimulate community partnerships, to dramatically increase testing throughout the community. We have a data work group that was able to help us use economic and demographic information to target the communities that we thought would be most at risk to specifically concentrate testing in those areas. And of course, in our community, the Hispanic community has really been very disproportionately impacted by COVID. And so we've created work groups that are specifically pulling in leaders from the African American community, church leaders, civic leaders. We've created a similar working group pulling in leaders from the Latino community, as we've really tried to listen to the grassroots, to get guidance on where to stimulate testing. And at the same time, there have been a number of work groups that are actively working on messaging, because messaging, what speaks to each of us is different, and how we're motivated or mobilized within our communities may be different. So we have reached out to engage folks across a lot of different sectors, economic and racial sectors, ethnic sectors, to get them actively engaged in developing the messages and following their leadership to say, this is the way to approach this in our community. This is a place that we should try to implement testing. This is the way we could communicate with communities. So I think that more than any issue in my lifetime in Chattanooga, I've been here 25 years, also not a native, but I feel like one, that it has radically brought the issue of healthcare disparities into very, very clear view. Last year, we created a task force on healthcare disparities through the Regional Health Council. And that has been, we've begun work there, but I think that we've got a whole new perspective and a whole new series of relationships to help drive that work forward. So basically, we're just trying to get the smartest people, most connected people in each community to tell us the best way to address this issue. So it's really very much become a grassroots driven effort to address a really horrible disease.
Absolutely. Thank you for sharing that. One point I wanted to back up as we talked about Dr. Pastor's slides. I wanted to make the point that United Way has done a whole study called ALICE that talks about families living in high poverty concentrated areas in Chattanooga. So for those of you that have not heard of ALICE, I would absolutely recommend that you reach out to United Way and get that information. Because it definitely backs up everything that he provided in his presentation. Shannon, I wanted to shift to you as Ray talked about the testing done in Hamilton County, but I recently read an article in Huffington Post that talked about how COVID-19 has devastated the Black community. I know for me personally, I have had several family members that were diagnosed with it. I even had a family member to pass away from the disease due to pre-existing conditions. So Simpa Community Care has been instrumental in testing communities of color. What can you tell us about how COVID-19 has impacted the Chattanooga community and some of the work that Simpa is doing around that?
Thank you so much for having me today. And I just want to start by saying that I am the data nerd. So all of the data that was shared just really spoke to my heart. And I'm not a medical doctor, I'm a CPA, but I have learned more and more to listen and to do a lot of studying from that end. So let's talk a little bit about why it was important for Simpa to reach out to communities of color. We have been intentional about doing so, building trust in the community. I know that was talked about a lot this morning as well. But we know that chronic conditions and poor health outcomes can significantly increase the risk of dying due to COVID. That is why it's a priority. According to the most recent 2019 picture of our health, that Black residents are 2.5 times more likely to die from diabetes, 2 times more likely to die from kidney disease, and 30% more likely to die from heart disease than the white residents of Hamilton County. So the healthcare leader, I charged in the recent Minority Health Task Force meeting, we can't call ourselves leaders if people are disproportionately experiencing these health outcomes. We just can't do it. We have to be intentional about giving them the opportunity to provide the care, the testing for this. Another comparison is 598 and 599 out of 600 zip codes. The worst health outcomes, we hold 2 of those in our own city and county. We have to offer COVID testing to communities who disproportionately are impacted by poor health outcomes. And so that's why Simpa Community Care made it a priority.
Thank you so much. I know with all the health disparities in the Black community, will you share more information about the Impact Hub and the partnership that Simpa has with MetMin?
Absolutely. So in one of those zip codes is actually Clifton Hills. The other one is Alton Park, Dr. Harris. So we are going to be opening a clinic inside Metropolitan Ministries' new Impact Hub. We will have an on-site clinic offering primary care services directly to the Clifton Hill communities. And so we are very confident that one of those zip codes is going to change and no longer be one of the worst in our state.
Mm-hmm. Absolutely. So Ray and Shannon, I don't know if you were able to address this question, but the number of hospitalizations in Hamilton County have increased dramatically. Are either of you able to add a little insight to that as to what's happening or what the numbers are looking like in the hospitalizations?
We have been seeing a gradual increase in the number of hospitalizations. The hospitals all report that they still have adequate resources and that they have PPE, access to testing materials. We have some folks in ICU. We still have ICU beds available. Some folks are in the regular mode of hospital care, and then there's some who are, getting close to being discharged. So the hospitals meet, talk regularly, and the health department talks to them all every day to review all of the numbers. So we are concerned. I mean, I think everybody in the community is concerned about the steady increase, and especially we're concerned about COVID in many communities has been really impacted older patients, and I'm starting to fall under that category myself. But the COVID cases in Hamilton County, we actually have a much younger demographic, and we've actually had some deaths in the 30 to 40 year age bracket, and one child who had pre-existing conditions. So it's something that everybody is monitoring continually. It is a sign for concern. But another concern that we've discussed a lot, every single meeting in the task force, is that we're also concerned that people are delaying needed health care out of concern for going to the hospitals. And that is a really significant issue. The hospitals are reporting a higher level of acuity among many of the cases that are showing up because they've delayed care. So while we are concerned about the COVID hospitalizations, we're equally concerned about people delaying needed care out of concern. The hospitals have done a really amazing job implementing protocols and ensuring the safety of both patients and staff. So I really want to encourage everybody in the community to go to the hospital when you need to, because you can have much worse outcomes if you delay.
Absolutely. I know that is a fear. It's a fear of mine. I had a shoulder injury and refused to go see the doctor. I just kind of waited it out. I figured I'd rather take my odds of fixing my shoulder myself. So I get that. With the task force and some of the things that you all are discussing, looking at the numbers rising, what should we expect? And are you all talking about the potential for another full quarantine?
If it's okay, I'll go ahead and answer this one.
Go ahead, Ray. Shannon, please.
Talking to our Chief Medical Officer, Dr. Jay Sizemore, who was the former Chief of Staff at Erlanger, one of our great sponsors for today. As long as we have the local resources to deliver care to those infected, as long as they aren't overwhelmed, which the medical experts right now are saying they are not, then the only way that we can really reduce the spread of this virus is social distancing, hand hygiene, masking in the public where social distancing cannot be guaranteed, and then continued access to testing for symptomatic individuals along with the appropriate response in contact tracing and isolation. So those key factors, as long as we actually take that advice and participate in each and every single one of those efforts, then I don't see the need for another full quarantine. I know that continues to be a topic that's discussed and concerned, but I will say I am very proud of our community for the enhanced testing. What we know now is that with increased testing opportunities, you're going to have an increase in the positivity rate. But at that point in time, we know who's positive, and we know that we can perform the contact tracing and we can have people isolate to prevent future spread of the virus.
Thank you for that.
Honestly, yeah, Shannon did an awesome job. I'm sorry. Shannon did an awesome job with that answer last week. And I recognize that we have 281 participants in the audience today. Last week, Mayor Coppinger really implored businesses to take a stronger stance and really encouraging clients who are going to those businesses to require masks to enter. And social distancing and wearing masks truly are our best enemies against a very intractable virus. So I couldn't miss the opportunity to ask businesses to really look at that seriously, to protect their employees and protect the public while we're still opening up the economy.
Absolutely, absolutely. And it's important to say thank you to those on the front line that are still working day in and day out. So I want to shift gears, and I want to talk about the second pandemic that's hit our country, and that's racism. And Ron Harris, I know that you have been working in the diversity and inclusion space for many, many years. In my mind, you are the D&I guru and one that I turn to for guidance and mentorship. But how are you advising your executive teams during this time? What are you all talking about at Blue Cross Blue Shield?
Thank you for that question, Dionne. That's a good question. We are a mature inclusion and cultural competency organization. And if you notice, I didn't say diversity.
Mm-hmm. Absolutely, I heard that.
We look at this journey that we've been on in excess of 2 decades. And one of the things that's very important to us is to understand that diversity is organic. I have absolutely nothing to do with diversity. If you have 2 people, you have diversity. We are an inclusion and cultural competency organization. Diversity is organic. Inclusion is intentional. Cultural competency is imperative. And we recognize that. And we take a top-down approach. And so when, not just because of the murder, the execution of George Floyd, but certainly we too are impacted. Our normal method of operation is to take a top-down, a leadership position on it. And we continue to do that. And my advice to the organization has been real simple. I just raised the question. As I talked to Dr. Hickey, our CEO, and the other leaders in our company, we talked about it this way. My question was very simple to a complex question, to a complex situation. And the question is, what are we going to do differently? Mm-hmm. That's really the question that needs to be answered by every organization and every individual who's involved in this fight for dignity, equity, and equality. What are we going to do differently? And some of the things that we talked about, and we asked them to consider that question, we talked about, let's review our policies. We do that often, but let's review our policies to make sure they're equitable. Even as the Supreme Court gave a ruling on LGBT community that they're now, should have been all along a part of Title VII. That was huge. but that has been in our corporate employment policy for the last 15 years because we knew it was the right thing to do. Leaders lead. And so we challenged, we've had top-down discussion, very gut-wrenching discussions, very candid discussions, not only with the leaders in our company, but we've cascaded it down throughout our organization. And we're going to talk in a town hall fashion to everyone. Our CEO immediately put out, well, not immediately, I take that back. We do things very thoughtfully and very carefully. So a couple of days after the murder, our CEO reached out to our workforce with a statement on racism and how it needs to end and how it won't be tolerated in our company. And we've cascaded that. We've talked about that internally and externally. We developed today, and it went out to all our employees, a manager's guide on how to have these critical conversations. We talked about how uncomfortable they are. And we don't mind discomfort sometimes because we have to be effective. And I often tell people, and it's one of my mantras, Dionne, as well, you know, that you have to suspend your right to become offended sometimes in order to be effective. And so we try to be an effective organization. And so we're constantly having these, we reach out, we understand that communication, no relationship is sustainable without communication. And it doesn't really matter what relationship you're involved in. If you are not communicating vertically, horizontally, and diagonally, then I will tell you without fear of contradiction that relationship is in trouble. Dr. Pastor hit on it, and I was going to say it as well, but the hardest part of any conversation is the listening. We've advised our leaders, our colleagues, not to read your autobiography into somebody else's life. Things might not be happening to you. Don't invalidate someone else's experience. There's nothing wrong with silence while someone else is sharing their pain and even their anger and their outrage. I described myself as numb, and I went through a period of numbness for several days, but I understood that I couldn't live there. In order to be effective to the 6,000 plus employees we have, we've got to give them an opportunity to say what's on their mind. You see, racism is a healthcare disparity, and your zip code should not be a death sentence. The color of your skin should not be a death sentence. It should not put you on death row just because of the color of your skin. You don't have to continue and shouldn't have to continue to be victimized by something as simple as your skin. Someone asked me several times, when did I notice racism? And my first recognition was flesh-colored Band-Aids. Over 60 years ago. But time has a way of healing. I saw Johnson & Johnson now has put out a Band-Aid in various skin tones. I can't wait to get cut to get one of those now that matches my skin. My skin shouldn't be my sin. And so it's important in organizations that you look at the systemic racism that's there. And you can't afford to be a silent or an unconscious contributor to racism. Let me do that one again. You can't afford to be an unconscious contributor to racism. We've got to challenge it wherever we see it. And we understand that at Blue Cross and Blue Shield of Tennessee. And so we started talking about unconscious bias years ago because we understood it. We also started to talk about having critical conversations. And I think you know this, Dionne, we brought on our campus Mary Frances Winters, who wrote a book, and the title of the book is, We Can't Talk About That at Work. This was several years ago. We can't talk about that at work. And so we've strengthened our education around all the things that's taking place. I got a call from another company, and they said, well, Ron, if we start to talk about this, we're going to lose some employees. People might leave. And my response was very simple. Education needs to be done. Now, if you educate them and they leave, that's not a bad thing. What the real problem is, if you don't educate them and they stay, your organization is going to suffer. And so we have a long list, Dionne, that I can't go through at this point. We are looking at everything from our scholarship programs to our hiring practice, to our interviews as well. You know, at mid-level in our company, we require a diverse panel of interviewers. Mm-hmm. And the reason for that is because when people walk in, they want to see people who look like them. And to the preacher's point up there, Miss LaQuisha, I think I'm pronouncing that correctly, she talked about the school system. Our kids are disproportionately affected and disciplined in school. And sometimes it's just because of a word. And I always say that word sometimes is about fighting. You see, to most white people, fighting means we got in an argument. To most Black kids, fighting means somebody got hit. And so if you use the wrong language, your language confines you. So we've got to be open. I didn't mean to get into all of this, but we've got to be open. And that's why the diversity piece has diminished for me, and that we've got to become culturally competent, got to understand one another. And so when you hear our leadership talk at Blue Cross, we talk about moving through those 3 tiers along our journey, from diversity to inclusion to ultimately cultural competency. And so we want to be the employer of choice in Chattanooga, but we want to make sure that we're the employer of choice for everyone in Chattanooga.
Ron,
and that's what's important. I'm sorry, I didn't mean to do all of that.
Listen, I realize I could sit and listen to that every day. Being live in the moment, some of it is hard to take in because I keep wanting to hit replay. Say that again, say that again, say that again. I am glad this is being recorded, because when this is over, I will be replaying it so that I can take fully in what you said. But I hope that those participating will do the same, because you gave so many amazing nuggets. One, especially as it relates to the human resources role. Who's in the interview room? When you look at a low number of people of color in your employment, you have to look at who's doing the hiring in your organization. What do they look like? What are their backgrounds? And what unconscious bias are they bringing into that interview? So that is something that really stood out to me. I could recap everything that you said. I do use your line a lot. I'm going to tell you the line of, you have to suspend the right to be offended, because in order for the conversation to be effective, to move forward, we have to be able to talk about it. LaQuisha, I wanted to kind of to switch over to you. I know that you play a large role in this work of inclusion and diversity, and you're consulting with many organizations. What are you talking about, or are you all having conversation about the Black Lives Matter movement in Chattanooga, and what is that looking like? What are you sharing with them about the importance of it?
So first, I'll start off by saying, no, we aren't talking about Black Lives Matter specifically.
Okay.
We're talking about the movement that preceded Black Lives Matter. We're talking about civil rights. We're talking about human rights. We're talking about all the movements that led up to what some are calling the Black Lives Matter movement. I made a statement to someone the other day that, you think there's a large part of the white populace that thinks that our tears in 2020 are about George Floyd, not recognizing that we're still crying about Emmett Till. And so as a people, as a country, we have to recognize there's been a populace of humans in this country that haven't felt valued. The humanity of their existence has felt very undervalued at several points in our several points in our nation's history that basically when Dr. Wiley this morning was talking about trust, I talk a lot about trust in our trainings. We actually start out talking about the equalizer that we all have, which is, you know, kind of the heart of who we are. And so we start talking about empathy versus sympathy. And that there's a big difference. There's a big difference between sympathizing and empathizing with the person. You know, sympathy basically is, oh my goodness, I see you down there. Sorry, you're down there. Empathy is, I see you down there. I'm going to come down from where I am and I'm going to sit with you. I love one of the best quotes I've heard. I think it was Brene Brown. She said, very seldom does a response fix a problem. It's connection that fixes a problem. So when I hear Mr. Harris talking about the culture changing, I think I heard Dr. Wiley early too, talk about the culture of the organization has to change. The culture of the organization, before it can change, it has to be diagnosed. And so one of the things that we like to, you know, to talk to organizations about is what is in the DNA. I've heard in countless levels of my professional career, I've heard people say that they didn't hire a person because they weren't a culture fit. And I would always ask that question, well, what is the culture? You know, what is the culture? Because your culture may be steeped in implicit, explicit biases. It may be steeped in a myriad of intentional racist behaviors, as well as unintentional racist behaviors. But one thing I know is that we have to start with a common language. I opened up a session with a quote from Paulo Freire that says, we can't get there from there. We can only get to a mutually agreed upon there from the same here. And that's where we are here in Hamilton County right now. We have to have a common language. We have to understand. I don't personally use the word equity. I don't personally use the word diversity and inclusion in this season, because what I found is that there are intersectionalities, okay? Please understand that there are intersectionalities, but when we use the word equity, typically in Chattanooga, we end up talking about socioeconomic and class. When we use that, we don't talk about racial inequity, we'll talk about the socioeconomic inequity. I've found that when we start talking about diversity and inclusion, we end up talking about gender and sexuality. And for this season, for this moment in time where we're looking at ourselves as a nation, we have to face the race issue. Race did not always exist. It was created. You can look in our policy as a colonized nation and see when it became a part of who we are. And so for this season, we have to be brave enough to say race, racism, racist, and anti-racism, because we cannot fix anything that we're unwilling to name.
Absolutely. And you hit the nail on the head. That word race is like a curse word when you talk about this work and something everyone wants to stay away from. Shannon, I know you wanted to chime in on this discussion. Will you share the points that you'd like to share with the group?
Sure, absolutely. And thank you, Dr. Harris. And I mean, everything that the panelists have shared has been so important. One thing, as a leader of a healthcare center, I recognize that our community, my staff, they demand action, not just words. And that starts within. Your team needs to trust and know that you prioritize them before the community is ever going to buy into it. Let's face it, I am not a woman of color. I am a woman. So I have to listen. I have to reserve my right to be offended. I have so many clippets from Dr. Harris as well. Two things that we acted upon 2 weeks ago in our staff meeting. Instead of covering any business, I told my staff that, and I'm going to be a little bit vulnerable, so if I get a tear in my eye, because it moved me so much, I was quiet and I listened to them. And for an hour long, my staff shared their experiences. Some didn't feel comfortable and reached out to me afterwards. And let me tell you something, it changed my life. It made me realize how much people need to have a voice. They need to know that somebody is going to listen to them and that they are going to act on what they share. They need to know that they're believed in. The second thing is that we had an internal conversation about making a statement right after the George Floyd incident. We decided not to make a public statement, and let me tell you why. Again, it goes back to action. And I believe that our community and the members that are being disproportionately impacted demand action. So what we did, we took the time to listen to needs from people that have been directly impacted, and we acted. So today, Juneteenth is a Simpa holiday. So my staff is not working. They are at home celebrating and honoring those and honoring this day. So I just would implore everyone to take action, to listen. So many times people look to us to have all the answers, but right now we need to listen to come up with the right answers and the right way to move forward. So thank you for letting me throw that in.
Absolutely. Thank you for sharing that and for being vulnerable in this. I did, before we went to the Q&A in the dialogue box, I read a question on social media yesterday, and I just thought I'd pose it to the group. And LaQuisha, you kind of touched on this, but I'm going to ask the question anyway. And what the response was is equality an impossible goal? And of course, we know that there's a difference between equity and equality, but are either possible? Are we really making strides in the right direction? I'll leave that open to anybody on the panel that's willing to tackle that. All right. Hey, no problem. I saw that.
Rephrase that. Can you restate it, Dionne?
Yeah. The question was simply, is equality an impossible goal?
Well, I think I would answer that question with the question. So you say, is equality an impossible goal? The question to me that I hear in that question is equality the answer?
Right.
So when I wouldn't even say that achieving equality is the sometimes we pose the wrong question, right? And we can answer. So I can answer, is equality impossible? But that's not really the issue here. If you take someone who has been starved for their entire life, all right, and then you take someone who's been eating for their entire life, and you put them in a situation, right? And you go, I'm from Memphis, and so we had the Wonder Bread factory in Memphis. And I remember on our way to church, I would smell the fresh bread. So I'm imagining a loaf of fresh bread, and you take those two center pieces that are very soft, right? They're almost identical. And you give one to person A and you give one to person B. That very same bread that came from the exact same loaf that will sustain the person that's been eating their whole life will kill the person that hasn't been eating. Because in order for you to digest that bread, you have to build up your system. So you need broth and liquids and juice, and then the bread. So equally, everybody got bread, but the equal thing that sustained the person that's been eating killed the person that hasn't. So I don't think equality is equality impossible? The question, the reality is that what does everyone need to be a productive citizen, to have adequate opportunity, to have access to the same amount of information, and to be able to be the quote unquote American dream, which I don't really know what it is anymore, because I think for anyone of any race in 2020, the American dream has changed. But can we get to a place where we haven't put systemic issues, structural issues, or structural obstacles in place that are impeding some success of one group over the other?
I knew you would be the right one to answer
and
that.
You know, I loved her. I loved her response. I'm glad that she differentiated between equity and equality, because my example was I love the Wonder Bread. So you might hear that again somewhere, LaQuisha. But mine was at Blue Cross. When we talk about, when you use those two words, we're 75% female. And I can tell you, we have women's restrooms all over the place. Now, equality would dictate that we have an equal number of restrooms for men, or reduce the number of restrooms for women, which would be crazy considering we're 75% female. And so equity, we have enough restrooms. It speaks to fairness. And it has to be done very thoughtfully because, as you said, words matter.
Right.
Words matter. And so we have adequate restrooms for the population of everyone. That's not equality, but it is equity. And that's important. And so we use words, and we have to be careful how we use them, because words, and I've heard a few during this period of time that have detracted from the discussion that really should be taking place. And so it's important that we differentiate, and I think she did it so well, that we differentiate between equality and equity. Because I think every human being just really wants to be treated with dignity and respect and fairness. I think that's a human aspiration. We can argue about those things around it, but if you trust me and you respect me and you treat me fairly and you communicate with me, I'm going to be more productive as a citizen and as a person.
Thank you for that, Ron. And I'll apologize to those that have questions in the chat box. I am going to go in and look and see if there are some we can ask, but we are running out of time. And Ron, this is a question for you. Would you be willing to share the Blue Cross Blue Shield Manager's Guide or a redacted version if there are some proprietary issues with sharing?
Absolutely.
Great. All right. Let's see what else we have in here. Let's see. Shannon, someone wanted you to clarify the zip codes for the direct clinics for Clifton Hills and Alton Park. Can you clarify your comment on that?
Sure. So, okay, I am unmuted. Sorry. So that would be 37410 and 37407 were the two highest zip codes. I believe I'm quoting that correctly. And there were 600 zip codes that were evaluated in the Tennessee Health Outcomes Guideline. And I'm happy to share a link to that website if you'd like to look at that. But yes, so it was Alton Park and Clifton Hills.
Okay, thank you so much for that. I'll look for one more question. Oh, well, I will make a comment. Unisex bathrooms would be the best option for equality, is something that someone made a statement. But Ron, when you talked about the number of female bathrooms, it definitely took me back to the movie, and why it's escaping me now that I'm mentioning it, where they did not have bathrooms for African Americans that were convenient, and how that they had to implement new bathrooms so that the women could continue their work. But with that, I just wanted to say, man, there was such rich dialogue on today's discussion, and we could go on, and I would love to continue in on the conversation. Thank you all again for sharing your time and expertise. As we conclude today's panel, I did want to close with a quote from James Baldwin, and it says, "Not everything that is faced can be changed, but nothing can be changed until it is faced." And I'm going to take a few liberties and expound upon Jessica Stallings' question, where she asked at the end of her presentation, and now that you have been faced with systemic racism, what bold move are you going to take today?